again, welcome to everyone that's already here. And I hope that some more colleagues will be joining in a few minutes. We already have more people coming. Apologies, the meeting will only be in English this time around. For the international meetings, we're going to have translation ready. Just muting the last people. Perfect. So thank you for coming. Gender, as some of you know, I'm working towards that with A2I quite a lot. The translation, yeah. Oops, I don't know. Teresa, can you put in the chat one more time how the translation is switched on with the 3 dots on top? Thank you. So yeah, since I'm working with A2I on the gender topic anyways, it's great that we actually managed to put in this short workshop, this short webinar in here, because now we're all thinking about how the prototypes can be finalized. And I would really like to add this gender perspective on it when you look at your prototypes one last time. And for that, we have invited Manoj and we have invited Anastasia. Maybe if we could just give you the floor for 1 or 2 words to introduce yourself again, Manoj. I think most people know you, but just for one last.
Sure. Thanks, Joshua. Hello, everyone. I'm Manoj Pandey. I am an advisor, consultant for the A2II on topics related to gender. And later today, I'll be talking about challenges in women's access to insurance and touch upon gender relevance in CDRI considerations.
Thanks, Manoj. And Anastasia, if I can ask the same from you.
Yes. Hi, my name is Anastasia Tomaides. I'm an advisor at the initiative for the Center of Excellence on Gender Smart Solutions. And we also have a parent initiative called the Global Shield. I'm an advisor there, and I advocate for gender responsive approaches within their activities. Over to you.
Thank you very much. And that's also going to be the structure of today. We're going to have Manoj leading in with some general remarks, also bring a first case example into it. And then we'll lead over to Anastasia, who can talk a bit more about the Center of Excellence and their approach to gender. And afterwards, we would really like to open the floor for questions. Also, if you can do it in regard to your prototype, think about it. What kind of questions would you like to ask at this point? So we can actually all benefit and kind of refine the prototypes a bit more with what we discussed today. And with that, I would already give it to you, Manoj.
Thank you. I'll quickly share some of the slides that I would like to talk through. Please do let me know once it is visible for everyone.
It's there.
Can see it, yeah.
All right, wonderful. Yeah, all right. So thank you again, Joshua, and hello again, everyone. My presentation here would essentially just set the context for looking at women's access to insurance in general, some of the challenges that exist, some of the insights that we have through A2II's work, and then hopefully that will set the stage for Anastasia to take the discussion forward. So when we talk about women's access to insurance, the first thing that we hear very commonly is that, oh, women or gender equity in insurance is a major business opportunity. IFC has actually projected that the women's market for insurance across all lines could be as much as 1.45 to 1.7 trillion US dollars by 2030. Now that's an estimate that's almost we have been knowing of it for a decade now, more or less. And an increase in GDP due to gender parity could actually translate into an additional $2.1 trillion in global insurance premiums by 2029. Life insurance is projected for 2x growth, health insurance to a 3 and 4x growth, and non-life insurance to a 2x growth as well till 2030, if we could have women's access to insurance almost at the same levels that is accessible to men, so to say. But that's the opportunity side of things. But when we actually look at what the tangible reality is at the moment, we find that women are definitely underrepresented in senior roles at insurance in the insurance industry themselves. 23% of reinsurance company executives, 10% of CEOs, 8% of board chairs globally in 2019 are women. And these are Fortune 500 insurance companies represented in there. What we also know is that women have carried a bigger brunt of the socioeconomic fallout of the pandemic that we have been coming out of in the last couple of years. More worryingly, women carry a disproportionately higher quantum of the negative impacts of climate change. So, how far behind are women as compared to men in accessing insurance? Well, we don't know. And why do we not know? We do not know the gender gap in access to insurance because no comprehensive data sets exist on women's access to insurance, neither on the demand nor on the supply side of things. While we speak with practitioners, experts, all of you included, you would say, yes, there is a disparity between men's access to insurance and women's access to insurance. We do not know by how much, and how much of that is rationally explainable and how much is actually just less than equitable access for women, even for those who are looking to have access to insurance or could consider having access to insurance. The Microinsurance Network's landscape study in 2021 says that more than half of the products and providers don't collect data on women per se. And that is largely the case we have found in a lot of countries, that sex disaggregated data is generally not available. Of course, there are challenges from gender or sex disaggregated data collection in terms of how definitions are there and how insurers collect data, digital channels, consumer privacy concerns, and the like. But long and short of it, we don't have a data-driven understanding of the access gap to insurance. Now, that is a major gap, because if we don't have that sex disaggregated data available with us, we do not know what products and services women are valuing or needing more as a customer group. We, as insurance companies, people who would like to see insurance becoming as universally available as possible, we don't know what distribution channels women prefer, what challenges women face in making claims. Basically, it's very difficult to have a comprehensive understanding of how the insurance industry deals with women as a customer segment. And you can add any list of questions in there which we cannot answer comprehensively when it comes to women's access to insurance. Now, what are some of the major challenges that we have seen in our understanding, when understanding why a gap exists? And the reasons are many. Some of the highlighted reasons here that I would like to share are lack of identification documents and asset ownership. For example, women are 9% less likely than men to have identification in the sub-Saharan African markets. Of course, this might vary from country to country, but in general, women have lesser paperwork and lesser direct asset ownership. Now, that is a challenge, because if a farmer wants to go and take agriculture insurance, and if she or he is needed to show that they own a piece of land on which they do agriculture, and they just can't have access to their insurance product. Now, that's a major challenge. Then, digital gap in gender as well. Women are 8% less likely to have a mobile phone and 20% less likely to be accessing mobile internet over a smartphone. This is based on data by GSME. Now, as we see, and we have stakeholders in the cohort for this lab as well, who are looking at digitally enabled education and awareness efforts, distribution efforts, where this is a major thing to consider. If women have less access to mobile internet, if they have less access to mobile phones, that gap becomes a systemic gap in terms of how it translates for women's access to insurance. Then, of course, there are socio-cultural constraints as well. Women face barriers in many societies while accessing insurance agents, other sales and service points, and sources of information, because they tend to be male-oriented. For example, what a study in India found, that women generally tend to prefer to buy insurance products or financial services from other women agents because they were much more easily accessible. What we have also seen is that, if insurance sales points are in areas, in marketplaces which are largely male dominated, it might be difficult for women to access those sales points, both either to buy those services or to get more information on those services. And of course, limited representation. I already talked about the numbers in terms of women being less represented in senior leadership as well as rank and file of the insurance companies. And again, these are just some of the key challenges that we see. But the reason for sharing something like this is to understand that women's access to insurance is not necessarily a question of the right product design. It is everything else that goes about making a service of values in terms of access, about information, about ease of use, things like distribution, marketing, and servicing aspects of it. Sorry. Yeah. So essentially, what the A2I's work is focused towards is that we need to move away from gender neutral to a gender aware insurance regulation and hence insurance markets. Now, the reason why we are making that distinction is that, and this is something which I learned during my time at A2II, is that during our trainings, whenever we have asked participants, largely insurance regulators, but also other stakeholders as well, to think of the default client, 90% and more times the default client is assumed to be a male. And this is just in de facto, and this is just one example of it, but that is a fact that is consistent across many years of these trainings being undertaken and how those default clients are taken to be. So in other words, gender neutral is de facto the male default client. And this is something we need to move to a more gender aware approach to both insurance regulation, but also insurance market interventions. Now, what does gender awareness essentially means? Gender awareness essentially means is to be aware of the key differences that men and women have on account of their physiology, their gender, their sex, in terms of the requirements. Now, there is data to prove that women are going to outlive men in almost all societies, emerging, developed markets, all included. Now, that creates a different kind of life insurance requirements and life cycle needs. Women have different health related requirements which differ from men. So gender neutral products may not meet these unique needs as well. And hence there has to be some awareness of designing such solutions, taking into considerations the realities in the market. Of course, climate and disaster risks have gendered impact. Hence, there is a need to analyze gender-aware data to understand those risks and impacts, as I will touch upon in another slide in a bit. But generically speaking, what do we need to do? We essentially need, how do we actually make our insurance interventions more gender-aware? And this is about, as much as possible, get sex disaggregated data. Now, the Femameter, the toolkit that A2II has developed in terms of helping insurance regulators collect sex disaggregated data in their jurisdictions is something that we are definitely trying in Nepal in terms of an implementation, very early stages in there. But essentially, that's one way of looking at it in terms of how we can go about collecting and supporting the use of sex disaggregated data, encouraging women's representation in leadership roles in the insurance industry, as well as at the supervisory level. So it's always good to see more women leaders at jurisdictions that we work in. Addressing gender differences in accessing identification documentations, digital channels, and the like. The idea needs to be that, once we start with that point of awareness that identification documentation could be a challenge if that is a part of the process, if accessing digital channels could be a part of the challenge, or the source of information that we are currently considering is largely going to be male dominated. If we are aware of that, we could possibly think of having more women sales agents, if that's something that we're looking to do, which could enable greater access to the target audience and more easy access for women customers. Implementing consumer protection measures to address gender differential risks and constraints, integrating gender dimensions of inclusive insurance into national financial inclusion strategies, because more and more markets are looking at a more bringing women more and more into the workforces, into the mainstream financial markets, and these financial inclusive finance strategies could definitely become more gender aware, and that would help women's access to insurance as well. But lastly, and encouraging gender considerations to be a key point of the checklist when we are looking at either doing our market research or designing product features or something to that effect, to make sure that we keep women's considerations as a special factor. Now, in my previous slide, I was touching upon how climate risks have gendered impact as well. And to support that, I'll just quote some insights that different UN agencies have put out in the public domain. Women and children are 14 times more likely to die in extreme weather disasters than men. By 2050, climate change is likely going to push more than 158 million more women and girls into poverty. That's more than men. Acute disasters disrupt essential services, including sexual and reproductive health care, which can have much significant impact on women as compared to men. Women in rural areas suffer substantially greater economic losses from the impacts of climate breakdown than men in developing countries. Research has shown, and the gap is likely to widen further. Households headed by women in rural areas lost 8% more of their income to heat stress, for example, than male-headed households. And the reduction in income when flood struck was 3% greater losses than the losses that men incurred in the same geographies. And why is that? It's mostly because women have limited access to information in terms of the climate risk financing and climate risk insurance solution that might be out there. They have limited mobility, so they are not likely to move away from those areas where the impact of these extreme weather events are likely to be very high. And that could be largely driven by socioeconomic constraints as well. Restricted decision making vis-a-vis who gets access to the smartphone in the house, who gets to make the financial decisions into the house, are they a part of the decision making process and the like, and of course restricted access to resources in there when in the households per se. So the challenge is that it's not that climate or extreme weather events specifically are acting in a manner that they affect women disproportionately. No, it's the socioeconomic realities and the constraints that women are exposed to make the impact on them much harder as compared to men. And that is something, again, is about making sure that we are aware of these gendered differentiation of understanding how the impact is at the end. And hence, how do we make CDRI considerations, for example, more gender aware? And it's that ultimately taking about gender lens to all aspects of CDRI. It's not that the parametric or index insurance solutions, for example, are going to be any different if they are looking at a woman customer as or a client as compared to a male customer. It's everything around it. So what does taking the gender lens mean? It means taking the existing differences between women and men in the context and the market and the jurisdiction, whatever that context be, into account when analyzing a situation and when developing specific approaches or programs. That's largely a UN endorsed definition of gender lenses. And that essentially means taking that gender lens to the context of the intervention, the products or services that are being done, and the processes built around that product. So just cite a very quick example of that is the Self-Employed Women's Association heat insurance program for daily wage women workers in India. Some of you may know that the SEWA, or the Self-Employed Women's Association, is the world's largest labor union of informal workers, informal women workers in the world, based out of India and the western state of Gujarat. And why? So SEWAs, during it works with its women members, understood, of course, intense heat is putting millions of poor Indians at risk. That's a given fact. Temperatures have been rising constantly, and they are having an impact on the health and earning potential, loss of income across the sectors. In SEWA found that for women members who live on less than $60 to $70 a month are amongst the worst affected. For example, Lataben, one of a typical member of SEWA, found that the sewing business that she did, the heat was too unbearable for her to continue doing the amount of work that she used to do previously in maybe when the temperatures are more manageable than that. And hence she loses out on wages, incomes for that particular period when she just can't function because it's extremely uncomfortable and her health is challenged because of the conditions that she is. She's a member of SEWA, as I previously mentioned. So SEWA, along with other partners, developed a heat wave insurance system that essentially addressed this need for its women workers in the informal sector, providing them with necessary support to cope with extreme heat conditions. So essentially, it's a heat index product, which essentially paid out $3 for every day the temperature breached the trigger point, which I think is 42.6 degrees centigrade, if I remember correctly. But I'm sure there's enough information out there on that product. And that's a substantially high temperature per se. And in 2024, the first year that this pilot was launched, more than 52,000 of the SEWA members enrolled into the product. 88% of them received a benefit with a payout worth $340,000. Now, Lataben, whose example I just gave, she only claimed $9 out of it. That's 750 Indian rupees roughly. But that was enough to cover for food and medication for a few days for that period when it was difficult for her to make her daily wages. So SEWA understood the context. It had designed a product that was sensible for its members. And how does it go about essentially putting that in process? And that is through SEWA understood that it could facilitate access to such products through their women's sales force. So essentially, the distribution that happened was essentially through women's sales agents who knew other women who they trusted, and they were able to convey the product and its value to them. Not only that, SEWA, because of its gender-focused approach, conducted the community research and awareness raising through women, and as well as using avenues that were accessed by women per se. Now, this enabled gender-aware inputs for the product designing that was done by international agencies and the insurance companies involved. It led to better understanding of the needs of its members and collection of the program and impact data. And it is providing guidance on the geographic and population selection for the pilot and hopefully the subsequent expansion that will happen. Now here, the product is no different. I think the same mathematics would go into designing any other heat index solution subject to where it is. What is different is situating it in the context of women, understanding the impact that is having and designing the benefits accordingly. And you know, that's just one version of saying it's customer centric, but we have to make sure that we understand that our customers are both men and women, and hence make sure that our products reach them and the information reaches them the manner in which it will be beneficial for them. I think that's the end of my presentation. Hopefully it gives us a good context to keep our discussions going forward through the rest of the discussion. Back to you, Joshua. Thank you.
Thank you, Manoj, for that comprehensive input and also for that practical example. It's lovely to hear. And I think we can do questions best at the end. So if you already have something from Manoj, note it down or already put it in the chat and we can ask it in a minute. And then Anastasia, if I can give you the floor, I would do that right now.
Great. I wonder if you can see my screen.
Yes, all there.
Great. Let me just get up my technology at the back.
Now we see the presentation.
Can you see the presentation?
Now we can see it.
Let me just stop sharing because I can't see things myself. 1 second, please. From beginning. Right. Great. So Manoj gave a really good introduction, which makes my job a little bit easier, and I don't need to go into too much of the background, but I just wanted to echo a little bit of what Manoj is saying, that women indeed often face a disproportionate impacts from climate-related disasters due to a combination of social, economic, and cultural factors. This includes economic disparity, having fewer savings and less access to credit, And it also limits access to essential resources such as land, education, that make it harder for women to prepare for, respond to, and recover from climate and disaster risks. So our focus with the Center of Excellence is climate and disaster risk finance and insurance. I'll reduce that very long term to CDRFI. And then I wanted to also mention that due to these risks, climate change could also exacerbate other related risks like gender-based violence. And this is on the demand side of MERSA, so looking at the beneficiaries. And if we don't use climate and disaster risk finance solutions, women often turn to negative and adverse coping strategies like selling off assets like livestock, taking out credits at high interest rates from informal institutions, or taking children out of school since the fees could be unaffordable at that point. So we do see that CDRFI plays a crucial role in building resilience for women in emerging markets by providing financial protection, promoting financial inclusion, and empowering women through capacity building and tailored support. So we had conducted a number of studies in the early days of the Center of Excellence, and this what led us to create this online repository of information and knowledge sharing platform. We wanted to provide the international community a place where we could aggregate all the rich resources that are coming out from organizations like A2II and aggregate this all into a knowledge and evidence section. We are an initiative that is hosted by the Global Shield, and I'll explain that a little bit later. And we have 4 guiding pillars for the Center of Excellence, as well as related activities. So in order for the, under the knowledge and evidence section, this is essentially our knowledge hub. This is where we aggregate research that not only that the Secretariat has developed, but resources that our members of the Gender Working Group have provided. And then I'll dive deeper into the gender analysis later on in the presentation. Under the guidance section, we wanted to provide some notes for users. It could be implementing partners or government officials on a step-by-step guidance on how to implement monitoring evaluation, genderless investments, and other topics on how to really integrate gender within their related activities. But we also saw the need to have like a one-on-one advisory service provided. So we developed a technical advisory facility to implement the guidance notes, and I'll go more into the technical advisory facility later. For the scholarship opportunity, this is something I'll address later as well. These are activities that I think is more relevant to you, but just a quick note that we also have an expert directory where we have access to consultants. So if there's an activity that you would like to have a consultancy for, you can go to this expert directory and have a look at the skills and needs that a person can provide for your specific work. And then addressing, we also want to provide capacity building. So we have a live talk series on the nexus topic of gender and CDRFI, and we focus on different niches, and we have at least 2 live talks on a yearly basis to address different needs, such as monitoring evaluation. We had one on gender-based violence last year, and we have another one coming up in November. So an activity that we offer that could be relevant for you would be the a leadership and diversity program for regulators. It's a course offered by Women's World Banking. The Center of Excellence, together with A2II, actually sponsor a woman leader and a senior official from an insurance regulator to provide support not only in developing a policy, but also support in developing a growing self-awareness skills for the woman leader. And we're currently offering a scholarship opportunity to Nigeria, Belize, Ghana, Guatemala, and Morocco in this year. And we're opening up the application process now in October for additional applicants for next year in case you're interested in applying. Now going into the gender analysis. So as part of our support to the Global Shield is an initiative to strengthen the financial protection and resilience of vulnerable countries and people. It aims to close the protection gaps using a toolbox of prearranged finance. We do this by having countries involved in the Global Shield come in through an in-country process, and I'll explain that a little bit later. But the Center of Excellence is there to provide a gender analysis, supporting the gap and feeding into the gap analysis that would be developed as a product coming out of the Global Shield in-country process. And we also are currently formulating a gender awareness training to help countries better understand why it is important for us to integrate gender responsive approaches into programs and projects and activities related to climate and disaster risk finance insurance solutions. So with our Global Shield, we have an in-country process. We have basically 3 steps involving the in-country process. We have the stock take, which looks at existing programs and projects within a specific country, as well as available information. And then we develop a report based on the information provided. Then with a gap analysis, we want to facilitate informed decision-making by the government who is undergoing this process. And we look at projected climate risks, including assessments on vulnerabilities and gaps in financial protection. And all this is to inform a request for support, which specifies the development objectives, financial protection targets, and instruments, as well as projects or other solutions a country is seeking financing for. So how the gap analysis is involved here, we bring in consultants to support with the stock taking on gender programs, what programs are specifically in a country that focus on gender. And then they craft the gender analysis accordingly. I can go more in-depthly. So we've recruited Oxford Policy Management to support us with this endeavor. They will provide, they provide an analysis on gendered differential impacts of climate risks. They look at the socioeconomic factors, understanding a country's context. They provide a picture of the extent to which women have access to and use financial services, including banking facilities, informal saving groups, insurance coverage, as well as formal and informal credit. And they briefly address the differences between how different genders have access to and use digital technology. And they use a combination of reviewing literature and data, as well as conduct quality interviews. One thing I forgot to mention is that with the in-country process, we focus on having a direct contact with government officials from the Ministry of Finance or climate change. And then they are supported by a support structure. In the case of Costa Rica, this is an insurance regulator, but otherwise it could be a consultant. And then they are developing the gap analysis, and we would provide a gender chapter to inform this gap analysis, and then later into the request for support. But the idea is also to aggregate various stakeholders such as local women's groups, CSOs, to collect this information and ensure that we have all the voices heard and we have a thorough gap analysis to make a proper decision-making for the request for support. And then going into another activity that we undertake in the Center of Excellence, it's the Technical Advisory Facility. We offer 2 windows under the Technical Advisory Facility with the aim of providing technical assistance and coaching support. So one is on a Global Shield window. So once the request of support is submitted, the technical advisory facility can pick up any requests related to gender and offer this one-on-one advisory. And another window is more open to the international community. And if you're seeking some one-on-one advisory, you could apply to the TAF for your specific needs. And then another opportunity would be getting involved in our gender working group. This gender working group allows the international community to also come together, share lessons learned, share their activities, formulate ideas, and also have an opportunity to develop capacity building. So it offers a wide range of getting information on what's happening with the Global Shield, how we're integrating gender, as well as other gender-related activities on CDRFI. I'm going to stop here. Thank you very much. I've also shared links to the Center of Excellence and the Global Shield. It's a really brief overview of what this is. So if you're seeking to learn more about the Global Shield, please do reach out to me and I'm happy to give more information. Over to you.
Thank you so much. Thank you, Anastasia. So again, thank you, Manoj. And now we would have a good 20 minutes for questions. So in case anyone would want to go ahead and already has something prepared, please raise your hand, unmute, or also just put the question. Yes, we already have the first one. Please go ahead. And just unmute and
Namaskar and good afternoon. I'm from NDRRMA, Boma Chenjang. Especially these two presentations are very impressive, but both only focused on the aspect of gender. But the Nepalese government is working towards the JHC concept. I think Manu sir also knows the very well. मनु सर यो एकदम जेन्डर मात्रै भयो जेटसीलाई इन्क्लुड गरेर चाहिँ अगाडि बढ्दा राम्रो हुन्छ है किनभने हाम्रो यो डिजास्टर रिस्क फाइनान्सिङ स्ट्र्याटेजी र वर्क प्लानले पनि जेटसी र हाम्रो वर्क प्लान जेटसीको पनि वर्क प्लानले चाहिँ अब यो जेन्डर मात्रै नभनेको कारणले यसलाई चाहिँ जेटसीमा कन्भर्ट गर्नु पर्ला धन्यवाद
मैं बस थोड़ा सा समझ पाया उसको गोमा देवी जी So you are asking essentially if that gender alone, but what are the other factors you want us to consider essentially onto this? If you could just repeat yourself one more time.
JHC, that's mean disabled and social inclusion.
Oh,
also.
right. No, exactly. I think what you're bringing in is essentially the wider DEI perspective, essentially. So diversity, equity, and inclusion, and that need not only be split upon the gender. When we talk about gender or inclusivity, it need not only be the dichotomy of men and women, but of course the spectrum around gender, that is one, but also disabilities and other challenges that are there. No, you are absolutely right. And the only reason why we are focusing on gender, at least why A2II has been focusing on gender just on a male to female dichotomy is because of the reason that it's the first starting point. When we are working towards inclusion, I think the first bigger umbrella, so to say, is essentially the key differentiation that already exists because of all the reasons we discussed between men and women and their access to insurance per se. But of course, the good thing news is that as this inclusivity expands, it will start offering the needed outlook and the receptivity needed by everybody involved, the stakeholders involved, to start making sure that the considerations start including people with disabilities, with special requirements, and other people who would need to be considered and be brought into that. It's not that their requirements or their challenges are any lesser than what we have discussed. It's just that we need a starting point. We need to go somewhere, but it's always good to add more and more. And if we have the capacity and the opportunity to do so, I think the approach remains the same, making sure that we remain conscious in terms of expanding how we can address this. So that would be my answer to it. But of course, if Anastasia or anybody else would like to add to that, please.
No add-ons at the moment. Does anyone else have a question? Doesn't seem so at the moment, so maybe I'll jump in. So as we all know, the lab is currently at the implementation phase. So really there's a lot of work that's already been done on the prototypes, and maybe it would be also interesting that we have two more of the ecosystem events coming up, maybe to both you, Manoj, and Anastasia. What would you think of as a stakeholder that's really important to the process, but very often also overlooked and not really taken too much into account? Maybe you have some advice there, some insight that you could share with us.
Sorry, I lost the audio for the last 10 seconds. Was it addressed to me, Joshua?
Really to both of you, Anastasia and Manoj, like maybe if you could highlight one stakeholder that you think is always really important to the process, but also very often or very easily overlooked that you would like give a spotlight to now, what would that be?
I can come in with this because we're facing this with our workshops that currently take place in each of the countries. We're struggling to really find and bring in local women's groups to these workshops, and we're trying to understand how it is that we can make these workshops attractive to attend. How do we make it more accessible? How do we actually access these women's groups? Where do we find them? We do have a close relationship with governments, but oftentimes we just find that it falls off the group, the eyesight, I guess, and we're not at that stage where we actually identify how it is that we attract them. We're still trying to brainstorm ideas. So if there's any opportunity, I see Manoj is nodding his head and maybe he has some insights. But yeah, we're struggling to find how we can bring in local women's groups into the conversation, because they're the agents of change. They're essentially the beneficiaries that we are trying to target. So how we address this, it's still up in the air, but we're hoping to provide you an answer at a later stage.
And just to follow Anastasia on that, I think what she essentially touches upon is that I think the very first layer, both in terms of education and awareness about insurance solutions in general and CDRI in particular, if that be the context, I think how do you do the awareness raising specifically for the women targeted, especially in emerging markets, and as we move on to the semi-urban and rural areas? I think that's one major challenge. And then second is I would, and almost equivalent to that is essentially the sales touch points or the services touch points, because I think those two are very important factors when it comes to a program's success per se. And from some of the experiences in the work that I have done, and we mentioned in the presentation as well, is that it always makes sense to have more women agents, for example, being as your point of sale, because they have easier access to other women and irrespective of the geography. So investing in more and more women who are part of your education and awareness efforts, marketing efforts, and sales efforts, just is a doubling rewarding effort, in the sense that you are not only creating and building capacities of women as professionals at that level, but you are actually strengthening channels of communication of women with women customers through a channel that they can actually trust. Of course, as Anastasia is mentioning, it's not an easy thing to do. So you have to actually find out the agencies, maybe civil society organizations in the region. We also have, for example, in some parts, in some of the markets, governments encouraging self-help groups of savings and credit societies, small groups of women essentially developed around it, linked with microfinance solutions. A very good example of that is also what the World Food Program does in its insurance products, is that it sets up these working group or self-help groups of these women farmers and starts educating them, and then through them also, of course, increases the helps increase the awareness to agriculture insurance solutions that they're trying to do, but also looking at providing either savings oriented support, or at least making women recipients of direct subsidies to be able to access those agricultural insurance programs. But it does take a bit of effort. It's not something that happens easily.
Thank you both. Very interesting answers. And now maybe if there are no questions, maybe also someone from the country teams would like to share how they've dealt with the topic of gender so far, how they took it into consideration in developing their prototype. So to share with the other teams. If not, I would just jump in. Oh no, we have someone. Yes, please go ahead.
I just have a question. Sorry for asking late, but the question is about you have Manoj here. You have mentioned in your presentation that you are trying to do like a specific program that is tailored to women, like where they go to shop, what they like to do. So how you identify all these aspects in order to like make a specific like tailored products for women. Thank you.
So if I understood your question correctly, you're saying that, how do we actually use that, make it a part of our project design per se, where we have this such touch points which are easily accessible to women? Is that correct?
Yes, and how you identify these indicators, like
Yeah,
that is
indeed.
specific for women. Yes.
It is, again, like I said, as we mentioned as I mentioned in the presentation as well, if the challenges that women have in accessing insurance are as much as economic, as much as it is socio-economic and cultural as well. So I think there is definitely a need to understand what those factors are which are limiting women's access to insurance. Of course, is it that maybe they are not involved so much in the financial decision making in the house, maybe because they might not be having enough control over the fiscal resources or the financial resources of the household. That could be a factor. It could just be that sales points or service points are at places where women might find it difficult to go. What I'm trying to put forth is that it is the thing to understand is that the things that we're looking to achieve. We want women to be more aware about the insurance products and services. We want them to buy or, reach out to the sales points or the touch points that we're making. And then the market research that we do, or the market or the awareness programs that we design, it needs to consciously try to understand. When I say consciously, it should make an effort to understand, to see what if a social cultural barrier exists on those things, and if yes, what can actually work for them. And if it is as simple as the fact that the sales touch points are in male dominated areas, then maybe more women sales agents are needed. But not that is jumping to the solution. Identifying the challenge comes from better market research, greater engagement with your customers, understanding them better, drawing their customer experience journey, and on the basis of that, designing those solutions. I hope that gives an answer. So the idea lies in better understanding of the context and better market research on that.
Thank you. And are you planning to identify it by doing a survey, or I don't know, do we have a mechanism how to like get this? Is it going to be a survey, or is it going to be like just
whatever works in your market? Yeah, I mean, there are no clear and obvious answers. I think, I mean, in an ideal world, if we had access to sex disaggregated data of access to insurance, we would have had opportunities to see what kind of sales interventions reaches women better. But since we know that in most of the markets we don't do, we will have to rely on these. So if you think that a survey is a good idea as well, maybe in-person focus group discussions could be an idea as well. I think it depends upon the audience that you have. If you have an audience which are possibly in a more urban or semi-urban setting, maybe a surveys could help you get better answers. But if you're going into slightly rural areas where awareness might be a little low, maybe focus group discussions are a better idea where you actually sit down face to face with your end customers and try to have a qualitative understanding of what the challenges look like from their perspective. So it depends upon the audience per se. And I don't think there's a hard and fast rule, but any effort that you go in terms of making and understanding your customers, especially your women customers, is going to pay off. So don't worry too much, and you will know exactly what tools are working for you and what tools are maybe, you need to augment that with something else.
Thank you.
Thank you for the question. Seeing another hand up, Udit, you have.
Yes, it's me. I'm Udit Kafle from Shikhar Insurance, Nepal. I have not a question. Rather than I want to share our experience on it. First thing is we have a Shikhar Insurance Company Limited. We have almost 50-50 is our employee. The share of this women is more than 40. Is something like equal. And after that, when we appoint the ladies, there are some we have to provide them some special consideration on the like for their menstrual period, for which we have provided some those facility, those beans in their washroom, and we provide one leave day per month additional for the ladies only during their periods. When they feel any kind of this pain or anything, they can be on a leave. That is once in a month. That is additional to the other leave. And one more, this provision presently made by our regulator is that there is at least one lady in a board of directors. That is just I'm saying like that. It is not a question.
That's great. Thank you so much for sharing. Renata, you have your hand up.
Thank you, Joshua. Thank you, Manoj and Anastasia, for these very interesting presentations and sharing your expertise and experience. I have a question related to an aspect mentioned by Manoj, and this is related to those situations where women are not allowed to take decisions, so to open a bank account or to buy an insurance, because those decisions are made in their environment by the father or the husband or the eldest brother. So as you mentioned that aspect, how do you deal with that obstacle? Because finally you want to achieve a higher uptake by women. So how do you deal with that obstacle in those different cultural environments? Thank you.
If I can try to answer that, Renata, that's a very, very pertinent question. And there is no obvious or easy answer to that, because ultimately, if there is a differential in terms of how the finances of a household are being run, and women having less say in those decisions, that is also going to reflect in the kind of choices they can make vis-a-vis. So that's a fact of life. And that is a change, and that is a challenge much bigger than access to insurance. So that's one part of it. The second part of it is, I think, and this is just based on my personal experience, while I had, I was so proud to give the example from Seva, because I also have had the opportunity to work with them for a year as their marketing coordinator more than 10 years ago. And there I saw something very interesting. What I saw was that even though in a lot of households as well, that it was the male who essentially made the decision of whether the insurance premium needs to be paid or not. The effort that Seva made by constantly informing women on the benefits of like health insurance product that they used to distribute at that point of time, for example. It was not a big product, about like $40 or $50 hospital cash kind of a product that was not hospital reimbursement based product that was there. They constantly raised awareness. So of course, building that capacity within the women, the understanding of it, so that they can talk to their husbands or fathers or whoever makes the financial decisions to be aware of such solutions and influence that decision making. That was one. What also helped in that was also that whenever they used to pay a claim at Seva, and I hope they are still doing it now, they would bring households from 20 other neighboring houses as well. And they would make a big show of the cash or the check that was not the cash, but the check that was handed over to the beneficiary. That had a very potent impact on women in terms of the effectiveness of insurance, making insurance tangible. And that always made insurance signups go up. So yes, there are certain challenges which are bigger than access to insurance, but we can keep working towards that by building, because as we are seeing, it is always improving. I think women are getting greater voices even in relatively more restrictive societies, so to say. And if they have that conversation going internally, they would be having the opportunity to influence such positive decisions, which could lead to access to insurance. But it's a much serious discussion and argument. That is where I would like to end. Right?
Do you have anything on that question, Anastasia, or are we good to close?
Just to echo Manoj's response, but also to say that, I mean, in disaster response, we find that in collection of data, sometimes it's important to remove a male head from the conversation and really just have women in the room. That way we can get the conversation going and understand what is it the actual barrier to accessing information, accessing resources. And with that information, this could inform how we develop products that are not just aimed at women, but for men, but at least remove some of the barriers that women have.
This Anastasia input just reminded a very good point. It's also like, how do you make subsidies smart? Like if you make sure that only if the woman is nominated in the health insurance program or a climate risk insurance program, and she's the only one who can be recipient of a government subsidy, that also creates greater empowerment and making sure that women have access to such coverages as well. So even when considering government policy making or subsidy decisions, we could look at ways in which more empowerment, financial decision-making empowerment could be given to women so that, they can access such solutions as well. So just adding on to what Anastasia was saying.
Thank you both. Thank you for everyone who asked question and was there. We're already at 1 p.m., so we've already made the full hour. I think if you have any questions regarding your prototypes, want to go forward, want to discuss any gender aspects, please just reach out. Always happy to forward emails also to Manoj and Anastasia, or see what we have in our HOI toolbox to support you there. So thank you very much for coming today. And looking forward to seeing you soon in the international meetings or for the national ecosystem events. And until then, take care. Thank you very much.
Thank you.
Thank you.
Thank you. Bye.
Thank you.
Bye.
Thank you. Bye.
Thank you. Bye-bye.
Bye.
Thank you. Bye.
Thank you. Bye.